Welcome to our first Community Health Improvement Plan Steering Committee meeting. That is a mouthful, but I am so glad that you all could join as we launch this important next step in improving health and well-being of Prince George's County residents. And I just want to thank you for lending your time and your expertise and partnership to this process. Next slide. So here's what we'll be covering today during our time together. We're going to start with introductions and do a quick icebreaker, and then we'll move into the purpose of the CHIP and the steering committee, talk a little bit about why you all are here. We'll provide a very broad overview of the MAP 2.0 framework that is going to guide our CHIP work. We'll walk through some of the highlights of the 2025 CHA or Community Health Assessment, and we're going to also seek your input with a group activity. So it's really important that you all are here today and that you all participate. And then as we near the end of our meeting, we will discuss the proposed CHIP development plan and then wrap up with your feedback and next steps. Next slide. So before we begin, I see some people have already done this, but I'd like to ask you all to just please type your name and your organization or your program in the chat so we know who is with us today. And I'll give you all a moment to do that. But also just want to remind you that we will be recording today's meeting. I just want to make sure that we're capturing our discussion. We'll be making some key decisions today, so we don't want to miss anything. So I have started that recording. If you are more comfortable going off camera, which some of you are already, totally fine. Do what makes you comfortable. But I still encourage everyone to actively engage in our discussion for today. Next slide. All right, so to kick things off, hopefully this works, we are going to do a quick icebreaker. And Deborah, if it doesn't work, we can just use the chat or unmute. It's totally fine. We were going to use this app called Slido, but it's being a little glitchy with us today. Totally fine. Gotta love technology. Oh, fingers crossed. We might have success. Hooray! Look at that. See? Favor. So if you want, you can scan this QR code or you can type the link in your browser, slido.com, and you'll input the access code. But let's just take a moment to respond to the prompt, which says, in one word, please describe what a healthy community means to you. So I'll give everyone a moment because I know it takes a second to kind of get into the app and use the access code. So in one word, please describe what a healthy community means to you. So there are no wrong answers, so feel free to put whatever is on your mind. This is just really to help us kind of start thinking about the kind of community that we're working together to build. So I see a few people typing. We have the word equity, inclusive, satisfied, vibrant, that's a good one, access, thriving, strong, support, happy, safety. Someone else must have said equity. I love it. I have a couple more people typing, so we'll give them a second. Oh, maybe they changed their mind. Autonomy. Great. These are all really, really great words. All right. So I just wanted to kind of do just this quick little activity just to give us a visual and to really work together and kind of understand and see how everyone is thinking when they hear the term healthy and community. So these are really great words, and we'll make sure we keep this so that way we have it for everyone to see. 1 second. Awesome. All right, next slide, please. So as Deborah moves into this next slide, I just really wanted to take a moment to share the Health Action Coalition's vision and values with you all today, because this CHIP process is really anchored in it. Our vision is simple, but I also think it's powerful, right? So we want a community that elevates the health and well-being of all residents, visitors, and communities. And the coalition's work is guided by the values that are on the slide that focus on reducing health disparities, promoting access to quality care, and fostering partnerships that essentially drive equity and impact. Again, this vision and these values guide and ground the coalition's work. They guide and ground how our partners engage with one another and will essentially be the foundation of this CHIP. Next slide. So now that we're all together, I do want to just take a moment to make sure that we're all grounded and starting from the same place, and that we have a shared understanding of what the CHIP is, why its development is important, and the vital role that each one of you will play to help make it successful. Next slide. So the CHIP, or Community Health Improvement Plan, is essentially just our collective roadmap for improving community health outcomes and advancing equity. So the CHIP will be collaborative, it will be community-driven, it will be data-informed, and it will help us align our partnerships and long-term strategies over a 3-year period. And this steering committee will be central to that effort. Next slide. So for those who know me, and for those who are getting to know me or will get to know me, you will learn that I am a firm believer that everyone should not only have a seat at the table, but should also have a voice at the table and be able to eat from the table too. And at the heart of this CHIP development plan is that same belief that everyone has a seat, everyone has a voice, and everyone can benefit from this table. So you each bring unique expertise and experiences that are not only going to be essential to understanding the health challenges that our county residents face, but you also have perspectives that will help to shape meaningful solutions as it pertains to this plan's priorities, the strategies that we'll develop, and the outcomes that we're seeking. So I am confident that together we'll be able to collaborate, make informed decisions, and really take action that truly improves the health of our county at every age and every stage. Next slide. So how exactly will you all help to do that? Great question. I'm so glad you asked. Well, as members of the steering committee, we will be seeking your assistance for a lot of different things. One thing, for example, we might ask is for your help in reviewing some of the CHIP goals, some of the action steps to help us determine whether they truly reflect the most pressing needs. We may ask you to confirm whether the data that we found aligns with what you're seeing in the field or what you're seeing in your work. Maybe you'll have additional data sources or data insights that we should consider. We might ask you to share CHIP updates within your networks. We might reach out to some of you to, well, all of you, to encourage community participation. We'll have surveys going out. We plan to do facilitated discussions, some focus groups, and you'll also help to hold us accountable to making sure that the decisions that we make are data informed, that we make them with equity in mind, and that they are community driven. So in short, you are helping to make sure we stay grounded in this process. And by grounded, I mean that we are staying grounded in evidence, in equity, and the community's voice. Next slide. Awesome. So now I'm going to turn it over to my colleague, Deborah. She's going to provide us with an overview of the MAP 2.0 framework and the data that will serve as the foundation for our CHIP. Deborah?
Thank you, Shanae. Hi, everyone. Good afternoon. And just to introduce myself for folks that don't know me, my name is Deborah Collier. I'm with the Office of Assessment and Planning. And I'm just going to go over briefly the MAP 2.0 framework and then also some quick findings from key findings from the 2025 trial. So the MAP 2.0 framework is a framework that was developed by NACO, which is the National Association of County and City Health Officials. It stands for Mobilizing for Action Through Planning and Partnership. This MAP 2.0 framework is an updated framework that looks at including community-wide strategic planning. So it includes not just the local public health department, but also the public health system, which includes community-based organizations and identifying resources. And it's also a big, huge part of it is health equity, inclusion, and also looking at community engagement. And just a little bit more about it, the MAP 2.0 framework is broken down into 3 phases. that we'll talk about in another slide. The three keys to MAP 2.0 process is first being strategic planning. And so the original MAP framework was not necessarily looking at strategic planning. It was mostly looking at just public health operation. And so the idea behind the 2.0 is the 2.0 framework is to incorporate strategic planning. The second key is that it is also looking at community-driven processes. So it's including that big piece that I was talking about before with community engagement. And thirdly, the success of the MAP 2.0 process, again, looks at the local public health system as a whole. So not just, again, the public health department, but also including hospitals, businesses, community-based organizations, and the like. And so this slide is looking at the MAP 2.0 framework from the different phases. So the MAP 2.0 framework includes three phases. The first phase being looking at building a community health improvement foundation. And that essentially the goal there is to establish partnerships, structure, and shared commitment needed to support a successful collaborative community health improvement plan. The second phase is to tell the community story, and the goal there being to collect and interpret data through the community partner status assessment, context assessment, and also the community partner assessment, community partner status, and sorry, the context assessment. So there are three different assessments and telling the community story. And then the third phase is looking at continuously improving what's happening in the community. So again, the MAP 2.0 framework is essentially a paradigm shift from operational planning to more strategic planning, and also looking at more community involvement and engagement, and also looking at ways that we can look at our resources and assets and use those to promote program planning, and also looking at the broad definition of public health, and then making sure that everyone knows something. And just to keep in mind that connecting the map to the CHIP process, so the CHA, which is effectively the community health assessment, and the planning is the CHIP, which is the community health improvement plan. So using the MAP 2.0 framework, you're essentially translating data into action. And then I'm just going to kind of switch gears and kind of discuss a few key findings from the 2025 community health assessment. So first, I just want to briefly discuss and the purpose and the background, like we talked about before with the MAP 2.0 framework. It's so just to make sure that everyone is on the same playing field. The purpose of the CHA is to support informed decision making and foster collaboration to build a healthier, more resilient community that aligns with the health department vision that all Prince Georgians are their healthiest at every age and every stage. And so this is just a collaboration between the county residents, which is via our resident survey, community partners, and also feedback from our key informant interviews, and also our hospital partners that are listed there. So using a modified partner and resident survey and key informant interviews, we provided the community which provided the community perspective. We triangulated those with secondary data in order to identify and prioritize areas of focus. So from that triangulated analysis, I just wanted to again highlight a few key findings. So the growth of the population has fluctuated over the past 5 years, with a 5% increase in the population from 2022 to 2023. There's also been a shift in the racial and ethnic makeup of the county, with a slight increase in the fastest growing ethnic population being Hispanic and Latino residents specifically. We've also seen an increase in the median income from 2018 to 2023. However, 11% of our county residents still live in poverty. And additionally, 40% of county residents reported the overall health of the county to be fair or poor. Other key findings focused on social determinants of health barriers, access to affordable housing, jobs and wages, or economic development were also identified as priorities. During key informant interviews, economic stability and food insecurity were identified as emerging threats impacting the health and well-being of residents. And we also saw higher rates of poverty compared to the state. An emerging and growing concern among residents was public safety, and that was specifically crime. So this visualization here is from the Agency for Toxic Substances and Disease Registry. The agency is tasked with determining, preventing, and mitigating the impact on human health due to hazardous substance exposure. So the SVI, which is the Social Vulnerability Index, is used as a planning index to determine the resiliency of a community before, during, and after a disaster. So it's used during the pandemic, the COVID pandemic, to determine equitable resource distribution. And the index comprises about 16 variables, including unemployment, poverty, education, housing, health insurance, and several other variables to indicate the communities with that had the greatest need for emergency supplies and support for recovery. So this map is a map of Maryland by SBI. As you can see, Prince George's County has a high SBI, indicating that we had a greater need for support before, during, and after a natural human-caused disaster. And this is a current map, so we're still currently sitting at high. Again, these were highlighted key findings from the 2025 CHA that can be used to kind of create targeted and sustainable and equitable solutions to improve health outcomes of our residents. The priorities identified as a result of analyzing the community feedback and secondary data are listed here: chronic disease, maternal and child health, or maternal and infant health, behavioral health, access to care, social determinants of health, specifically, again, public safety or crime. And this 2025 priority list is not that different from the 2022 CHOP priority list, with the exception of cancer that was identified in 2022. And then we can also see, looking at the priorities listed from the state perspective or from their assessment, that essentially they are pretty aligned in terms of priorities. And then this is just looking at different ways that different entities can utilize the CHA information in the CHA document. And so currently the 2025 CHA is on the health department's website, as well as PGC Health Zone platform. It's accompanied by a feedback survey for us to just kind of better understand how we can make the CHA useful to folks in the community and to other organizations, and to make sure that we're just including indicators and information that will be helpful to serve our residents. Also, I just wanted to take a quick minute to just kind of mention how these different entities can use the CHA. If you're a community organization, you can look at data from lens of how of different, different things. And so if you're a community an elected official or county leader, you can kind of ask yourself, how can the data be sorted by age, race, ethnicity, and location to help target programs and provide baselines for programmatic metrics? If you're a community organization, how could data and health findings strengthen your grant writing or reporting? And then also looking at residents, faith based groups, and businesses, just kind of asking what issues identified do you want to work on, and what could you do to help improve the health outcomes of residents in the county. And I think that may be the last slide for this. And now I'm going to hand it back over to Shanae for the group activity.
Awesome. Okay. Well, thank you for sharing, Deborah. I really, really appreciate you doing that. We are going to do a group activity together. So now that we've kind of reviewed that data, let's shift to this discussion. So for each priority area that Deborah mentioned, you're going to see one or more problem statements that were derived from the community health assessment. So we'll remind you what those priority areas are in a moment, and we'll go topic by topic. But as the steering committee, we're just asking that you all consider which statements should be prioritized during this CHIP process. So those statements that you believe would have the greatest impact if we addressed. And we're going to use the Teams polling feature, and then, we can open the floor for group discussion so we can capture your votes and your insights. So let's go to the first one. Our first topic is chronic disease. So again, we looked at the CHA, we pulled out some problem statements, and you'll see them on the slide, but let me go ahead and launch the first poll. You should see in your chat. Which problem statement should be prioritized during the CHIP process related to chronic disease? So our first option, high rates of obesity, hypertension, diabetes, and heart disease persist among adults in Prince George's County. Chronic disease rates are disproportionately high among Black and Latino residents, reflecting health inequities. And then preventive care utilization remains low, leading to late-stage diagnosis and hospitalizations. So you can take a moment to vote in the chat. And if anyone has questions or comments or feedback, this is the time to share as well. Hopefully I can see both. I see 8 people responded so far. Great, and this is anonymous voting, so we can't see who said what. So 11 responses so far. It's pretty close with the first and the third, but it looks like as of this moment, preventive care utilization remains low, leading to late-stage diagnosis and hospitalizations. Anybody? I feel like I may have heard somebody. Was somebody trying to say something?
This is Stacy. Oh gosh. I like the preventative care one, but I also am very aware of the difficulties individuals have in navigating healthcare systems. And now with changes potentially in Medicaid and access to healthcare products to support them in getting care. Our federally qualified health centers and community health centers are severely, overtaxed and don't have enough under resourced. So why I agree. Yes, this is a true statement. It is. All of these are just loaded with so many other factors that impact the health and wellness of our residents as it relates to hypertension, diabetes,
I
and
agree.
heart disease.
Thank you for that feedback, Dr. Little. I appreciate that. And I absolutely agree. Any other comments? Deborah, I don't know if you wanted to add some insight as far as data.
I'm sorry, can you repeat the word you said?
I didn't know if you wanted to add any additional insight or background for any of the data that you've found related to this.
No, I mean, I agree with what Dr. Little mentioned. I think, the statements are here because they, are all good. There's no wrong answer here. If we had funding and time to, look at all of these, this would, all of them would be prioritized. But in terms of being able to, do things that are feasible and actionable, I think that's kind of what we want to keep in mind. So if you were to look at a 2025 chart, there's a lot of data in there looking at the high rates of obesity, hypertension, diabetes, and heart disease. There's not a lot of data in there looking at preventative care utilization. There is some, but there's not a lot because it's not something that's focused on a lot. But that's also could be telling a story. So it's something to think about in terms of where we want to focus our attention and prioritize. Is that something that we want to better understand? If it's, if we're continuously looking at access to care being a huge priority in the county, then maybe we want to see other ways that we can impact that from a public health perspective. And preventative care utilization may be one of those.
Absolutely. Dr. Little?
I so appreciate your comments. I think it's Deborah. Um,
Yes.
uh, yes, because in my thing it's truncated. But all of them are correct. But I think there's definitely number two. There's a tremendous amount of fatigue when with among
Mhm.
our residents when we highlight the differences by race and ethnicity. So definitely that one I think just creates triggers. It triggers sometimes. In my experience in working with community and doing health promotion and disease prevention work. That's one that I think there's a lot of fatigue. And then the first and the second, this first and the third, is there an opportunity potentially to combine them in some way? And then lastly, I do think one clearly aligns with the state health priority.
Mhm.
And so that sometimes makes things a little easier when when the efforts of the county align with the state in terms of resources and support for efforts being considered at the county level. So just food for thought. I'm not really giving any final statements here. Just I more like mushings, I guess, things for us to consider. But definitely I guess I'm my least favorite is to um interested in maybe considering a combination of one and three, and then number one being to me the safe bet. It's the safest bet because I know that that statement could clearly aligns with the state health priority.
Yeah, thank you, Dr. Little.
It looks like Dr. Somerville agrees with Dr. Little's comment about combining the first and third problem statement. Um, and so just to let you know that, I don't know if you could see the information in the
Yes,
chat.
thank you. Yes, great food for thought. All right, this is all great feedback. Thank you. I think we can move on to our second problem statement. Let me see. Do you mind going to the next slide, Deborah? All right, so as it pertains to maternal and infant health, our first statement reads, infant mortality and low birth weight rates in Prince George's County remain higher than state averages. Our second problem statement, many pregnant women lack consistent prenatal and postpartum care, particularly those with Medicaid or without insurance. And our third statement, social and environmental stressors negatively affect maternal health outcomes. So housing, income insecurity, and racism. Looks like there's very consistent consensus so far. We have 4 responses, 6 responses. That was an easy one, huh? Okay. So out of the 10 responses we've received so far, they are all 100% saying that many pregnant women lack consistent prenatal and postpartum care, particularly those with Medicaid or without insurance. And I think that is particularly relevant given the climate that we are in right now. So this doesn't actually surprise me at all. And I'll leave it open a few more minutes just in case there's any others who want to add their input. Any comments or questions?
I just had a quick question for folks. I guess just I don't disagree with that, but I guess or it's not unexpected. Just out of curiosity, why if anyone was waffling between the second and third problem statement, and kind of what pushed um if you were waffling between the two, what kind of pushed you over one way or the other?
For me, number three is it's really referencing the social determinants of health, which within public health paradigms we get it and it's understood. But even in the public health realm, we still have challenges with operationalizing what social determinants of health mean, how do we respond to it, what resources do we have to address it, etc. I can tell you in health systems, there's really limited understanding of how health systems respond to social determinants of health. So it's just, when I think about these statements, I think about how do we choose statements that resonate and that also reflect the real issues that we have in our county, but and also because we're talking about partnership, right? We're talking about
Mhm.
where are the opportunities for planning and partnership across
Hmm.
multiple disciplines, and it's just I'm a strong proponent of of understanding social determinants of health. I can just tell you, it's just a hard road to get uh, to get consensus understanding. I think people generally get it. I think where the rubber hits the road around for most is what do we do about it? Why is that
Mm,
our problem? Why is your house? Why is that person's housing problem my health
problem.
system issue?
Mhm.
It really is contentious in a lot of ways, and so um, I struggle with this one. This is my passion, but I've been in this field a long time around this work, and I can tell you that number three, we're still struggling to get to really get a real understanding across disciplines on how we can be responsive to the issues around social determinants of health and how that impacts people's overall health and well-being and how everybody has a role to play in this work. Um, anyway,
Okay.
now I feel like I'm on my soapbox, so let me. You got something?
No, you can hear the passion in your voice, which is what we all need, right?
Yeah,
And I guess one of the other reasons, just asking, again to your point about the social determinants of health, you know, is that an area where we could be more actionable? Or, is there areas where even within the many pregnant women, the second statement, are there things that, things you can think of that are actionable to lead to this kind of better outcome? Just a question for thought. We can move on.
Yeah, I mean, two really is three is a factor of two, which then
Yeah,
drives one.
which then, yeah,
definitely.
I was just about to say
Okay.
that.
Exactly.
Yep.
Yeah.
Yep.
Exactly.
Any other comments, feedback from the group? All right. We can go to our next one, behavioral health. Let me find that poll. All right, I'm going to go ahead and launch that poll. There are only two problem statements for this one. But as it relates to behavioral health, the two problem statements are rates of depression, anxiety, and substance use are rising among county residents, especially youth and young adults. And the second problem statement, suicide ideation and attempts among youth, particularly LGBTQ plus and Black youth, have increased in recent years. So you can respond in the poll, and if anyone's having issues with the poll, feel free to type your response in the chat and I'll mark it down. So again, we want to think where can we have the greatest impact? Where can we build on partnerships to really take actionable steps to address these problems? I have you noted. I also have you, Dr. Little. Thank you. All right, so 11 responses. So it looks like most of us are leaning towards rates of depression, anxiety, and substance use are rising, especially among youth and young adults. I'll open the floor for any feedback or comments.
I have a question. This is Jessica. Hey, I
Just
just because, yeah. So, how is this measured? Just from like, I'm just curious. Like, for I know with American Heart Association, I know mental health, we're really tying it to obviously increases of a lot of factors when it comes to chronic disease with heart disease and things like that. Mental health obviously plays a huge factor in that. But when we're talking about very specific, behavioral health is with depression, anxiety, and things of that nature, or even number two, when we're talking in that, how is this measured in the county to figure if we are really, in fact, making an impact with any type of implementation strategies that we put forth?
Some of the ways that it's being measured is looking at our YRBS data, also looking at our public health, behavioral health utilization data. Those are two ways that we utilize, in terms of looking at
Okay.
metrics and things like that. And Stacy, I mean, the public health, behavioral health service data is claims data. So
Okay.
I was curious,
But
Margaret, or
I will say
oh,
that claims data is only telling us the number of individuals by age, ethnicity, race, etc., who seek behavioral health services and the type of diagnoses, etc. Right? But it doesn't give us the where I think this is going is so well maybe not, but I'm thinking, are we trying to think about prevention here? What could we be doing to more preventative services, especially around anxiety and situational depression? Are there certain things we could be doing as a county, particularly for youth and young adults, differently? Because we do see an increase among young people with anxiety and situational depression. So when I this is important, and this is definitely happening in our county, and we have data on the nuts and bolts of it, right? But where are we really trying to go uh, with the plan? And I guess maybe that comes later, thinking through what as a county we want to do to address the rates. Um, yeah.
now, I guess I'll also let Shanae if she wants to. I think some of it is looking at the data to see what gaps we have in terms of what information we should collect. I mean, I think, for instance, we use our RVS data, which is self-reported data. We also look at other data, utilization data, inpatient data from HSCRC. So we utilize a lot of different data sources to kind of get us to looking at to better understand what we're dealing with. But what we, I think, sometimes falter is like asking students, asking our youth and our young adults what they need. Because sometimes I think we spend a lot of time telling them what's happening to them, but we don't necessarily spend a lot of time asking them, how do we be of service essentially. And so I think that may be a gap in terms of being able to provide, addressing the rates that we're seeing. But that's just, my opinion.
any other comments, feedback? All right. I'm going to go ahead and close this poll and we can move to the next, which I believe is access to care. So I'll go ahead and launch this poll. So as it relates to access to care, there's three problem statements here. Transportation barriers limit residents' ability to attend medical appointments or access specialty care. Health literacy challenges make it difficult for residents to navigate available services and resources, and language and cultural barriers contribute to lower utilization of preventive care among non-English speaking residents. There's a question in the chat from Dr. Little. Do we still have YRBS federal staff implementing this research? I'm not sure.
And just when you say federal staff, are you referring to the CDC?
Yeah. Uh-huh.
Okay.
Because they were
Yeah, they do.
gutted.
I
Uh-huh.
know.
Uh-huh. Yeah.
So they do still, so the idea is that, the CDC they do provide that national data, but the data is provided to them by the state, then the
By
local,
the states.
government.
Uh-huh.
Yeah. So
Uh-huh.
then the local government are the ones that are administering the survey to the schools in the different districts and jurisdictions.
Mhm.
And so it just kind of filters up to the CDC in that way.
Okay, so maybe they have
Yeah.
a contractor who has the bodies to actually do the analysis. Same
Yeah.
kind of issue
But
we
we
have with
still have
plans.
access to the data regardless of whether it makes it to
Yeah,
CDC or
yeah.
not. Yeah.
Okay. I just was wondering because I know CDC is just in limbo right now.
No,
Okay. Mhm.
looks like we have 9 responses so far. 88% health literacy challenges make it difficult for residents to navigate available services and resources. Christine, I think you're on the call. Is Christine Stewart still on the call? Oh, she might have hopped off. Dr. Little, I have your vote. Awesome, great. I'll open the floor for any comments or questions. I think there's a lot that we can
Yeah.
do.
Hey, it's Jessica again. For the health literacy challenges, and as far as the navigation of available resources and services, are we also talk about health literacy as it relates to technology? So, for example, if we're talking into access to care, I was kind of pivoting between two and three, and now really looking at
Mhm.
one because I'm still thinking about, access to care. It could be obviously, are there issues? Are there barriers when it comes to technology, when it comes to logging on to whether it's Teams, Zooms, or whatever virtual platform? Some residents, there might still be some of that technical barriers. Is that addressing that too, as far as navigating those available services and resources? Is that what
I
we're
would,
also, I just want.
yeah, I would think it's inclusive of all of
Okay.
that.
Okay.
Yeah, because anything that impedes any kind of understanding or access or being able to apply health information, that to me is what's embedded with health literacy. And number 3, language and cultural barriers, they all significantly contribute to health literacy challenges as well. So this is kind of one
Right.
of those other things where, one
Yeah.
problem statement can affect the other, which can affect the
Right.
other. But I think all of these things can be addressed. And when we finalize what, our decisions for these problem statements, and then we bring them to our work groups, we can work through all of this and figure out how we want to address what's feasible, what makes the most sense, what would have the greatest impact in our community. But all of that is included.
Great. Thanks.
Sure. Any other thoughts, feedback? We have one more. This is for the social determinants of health. Go ahead and launch this poll. For social determinants of health, there are 3 problem statements. The first is high housing costs and limited affordable housing options contribute to housing instability and stress. The second statement reads, food insecurity affects many households, limiting access to nutritious and affordable food. And the third statement, environmental hazards and poor air quality in certain neighborhoods contribute to respiratory and chronic health conditions. These problem statements are related to social determinants of health. So again, thinking about what we can do, where we can have the greatest impact in our communities. See 11 responses, kind of between the first and the second, but it looks like we're leaning more towards the second, which is food insecurity. Any thoughts, comments? Deborah, when you look at the data, does this seem to be consistent with our voting?
And I think things that we should, just consider, like, kind of, that's just, I think, on the horizon of things and impacts, is that last one, environmental hazards, and poor air quality in certain neighborhoods, that contribute to respiratory and chronic health conditions. I don't know that, many people consider our environmental impact, and I think that that's something that, we should probably start to take a closer look in terms of, if there's ways that, things that we can do to kind of, from an environmental standpoint, even built environment, figure out ways that we can, impact that. But I think the second problem statement definitely aligns with what we're seeing in the data in terms of food insecurity.
And for those who are working directly with community members, what is some of the feedback that you're getting from them? Are you hearing them talk more about high housing costs, access to food, or things like their built environment, poor air quality? Dr. Little, I see your comment. I also have your votes as well. I'm concerned about potential housing issue fueled by economic insecurity. Yes, absolutely agree.
I think there are some communities who are far more astute around environmental hazards because of the what do they call, like factories that are emitting certain substances in the air near where they reside, that's going in their water. That's so it's just it's more ever present, in certain parts of Maryland, particularly in Baltimore. This is definitely, I've been in meetings where people are this is on the agenda, the environmental hazards, where here in Prince George's County, I'm on meeting. We don't talk about, you know, uh, environmental hazards as often. But when I'm in meetings in Baltimore, I'm hearing about pollution. I'm hearing about lead paint. I'm hearing about asbestos, and but not. So I think this issue around environmental hazards, maybe it's because people are unaware of the hazards that may exist across the state, or do we really have this is this really a huge issue in our county, or is it more of a huge issue across our state? I don't know.
And
I
I
don't
think
know.
it's no, I mean, I agree with what you mentioned, Dr. Little. I think, for instance, in Cheverly, there's a lot of folks that are very much attuned to the poor air quality there in their, in their community, local community there. And so I agree. And, we are hearing about the different, the feedback that's coming from, the potential data centers that are being discussed and things like that. And so the environmental impacts and things like that. So I think it's just, just kind of keeping that on the forefront of our minds too, that we don't forget about some of these things that are happening in our kind of built environments that impact our health as well. But um, I think definitely the food insecurity was brought up by key informants as well as our resident surveys. So I think that's definitely aligning with, how residents are feeling.
I would say, I think we'll start to see a lot more traction around environmental health in the county. For those that
Mhm.
don't know, there's the Interagency Climate Committee. So it's all the county agencies, and we meet like once a month to talk about what everybody's doing related to climate change and how they can collaborate to address some of these things. And so definitely kind of one of the goals is going to be to get the word out on those things too. So it'll be nice to see some more movement related to environmental hazards. But I know that food insecurity is also a big priority related to the state health improvement plans. I think that'll put us very in line with what they want to work on this next couple of years as well.
Thank you for that. All right, I'm going to go ahead and close this poll. Are there any other comments, questions? All right, well, let's move on. I'm still closing this poll. Okay. Sorry. Deborah, can you share your slides again?
Yep.
Thanks. All right. So again, thank you just for your participation in the group activity. I think there's some good comments made, some great insight. So now that we have those priorities identified, we're actually going to take a look at what we've done so far as it pertains to our CHIP development plan, and then look ahead to what's to come next. So as Deborah mentioned, we are using the MAP 2.0 as a guiding framework, and she's already talked through that, so we're not going to go through that again. But at the end of today's meeting, we will have officially completed phase 1 of our CHIP plan. So that's exciting. So I'm going to share a little bit about what we've done already. Next slide. So as mentioned, our team has completed and published the community health assessment, which identified the 5 priority areas that we talked through just a moment ago in our group activity. And we've shared those key findings with you all. We've shared it with our coalition members, some various partners we've been invited to meet and discuss with them. And we've also established this CHIP steering committee. So we're meeting with you to review our proposed CHIP plan. We've voted on our problem statements for each priority area. So we thank you again for helping us work through that. And so we essentially laid the groundwork for this CHIP and for our coordinated approach to improving community health. Next slide. So now that this phase is nearing its end, we will move into phase 2 of our CHIP, where we get to gather community feedback to tell the community story. And this is the part that I always like the most, because I always really like to get insight from our community members. So within this phase, we will include facilitating multiple group discussions in November, where we will share the selected problem statements from today with our work group members. We'll share a little bit of data with them. We'll gather some feedback from residents, from our partners, to better understand needs, gaps, and opportunities. So we're really going to get into the weeds of these problem statements. So again, we've invited our coalition work group members. They're going to participate in our topic-based facilitated discussions. So they'll share their insights, their expertise, and their lived experience. And the idea is that this discussion will essentially just allow us to dig deeper to help identify what those underlying root causes of these issues are. And the feedback that we get will directly inform some of the priority setting and the strategy development for the CHIP. Once those discussions are finished, we will share those preliminary findings at the larger December coalition meeting, and then we'll talk about next steps then as well. But we're also hoping that as the new year approaches, we'll be able to partner with some of you all, some of the community organizations that are represented, to hopefully coordinate a similar facilitated discussion with members of the community and get their insight as well. And I actually also heard from one of our coalition partners, there's a group of representatives from federally qualified health centers that want to engage in this conversation as it pertains to maternal infant health. So hopefully we can get them on board as well. Next slide. Our final step of the CHIP, so this will lead us into our third phase, which is to continuously improve the community. So during this time, we will transition into our newly aligned coalition work groups, which I will share about in a moment, and we will begin drafting action plans to really define and refine some of the goals, some of our objectives. We'll outline the specific strategies we want to use to address these problem statements. We'll talk measurable outcomes and any kind of identify potential partners that we may want to work with for this plan. So as the action plans are being developed, we will work closely with you all for feedback, and then we'll work closely with our communications team, with our work group co-chairs, coalition work group members, as we draft and review the different parts of the CHIP document. Once that's finalized, we hope to publish it, hopefully in July, so fingers crossed, and then we can share the CHIP with community partners, county leadership, senior staff, and then move into implementation. But we know that with implementation, we have to make sure that what we're doing is effective. So we will have an evaluation plan in place as the CHIP activities are being monitored over time. Again, I like to think of this CHIP as a living document, so we can update those action plans as new data comes about, as priorities evolve. I know we were kind of torn between one or two of the problem statements, so things might shift a little bit, and that's okay, because what we want to do is make sure that we are focusing on what the needs of the community are. So this is, again, just a 3-year ongoing cycle of improvement, of evaluation, and adaptation, essentially, to make sure that we are having a lasting positive impact in our county. Next slide. All right, so to support this work, we will be realigning our coalition work groups to better match the 5 CHIP priorities. On the screen is our current list of Health Action Coalition work groups. So we have our Behavioral Health Advisory Group, Community Care Coordination Team, our Health Equity Work Group, and Healthy Eating, Active Living, which we had a Food as Medicine subcommittee kind of form under that as well, which has since been sunset. Next slide. I want to share with you all the proposed restructuring of our Health Coalition work groups. We will be renaming the work groups not only to align with the priorities that were identified in the CHA, but also to directly connect them to CHIP strategies. So as we do this, we do want to keep equity and accessibility front and center. So each work group name will has been shifted with health literacy in mind. So we're using plain language, simple, clear language that community members can easily understand, that can be translated well into other languages. These names are consistent in style, which I think helps to create more cohesion across our work groups and helps to reinforce positive action-oriented outcomes. And then you'll notice at the bottom, health equity appears across all of the work groups. And that is intentional and it's super important. Health equity is foundational. I think it should be a foundational thread that spans across all of our priority areas. So I think to make sure that those health equity principles are fully integrated within each work group, I will be asking and encouraging our current health equity work group members to join and participate some of the other work groups where their expertise and their interests may align. And I think that this will help us embed equity considerations into every plan and every strategy. Again, everything that we do with the CHIP should be with the community in mind, with equity in mind, to advance those efforts. And so once our newly aligned work groups are situated, they will develop their action plans to outline how we want to address each community health priority, to make sure that the right partners are at the table for planning as well as for implementation and evaluation. And then they'll help facilitate and monitor the progress within each priority health area as well. Next slide. All right, so I do recognize that this CHIP process is pretty involved. So we're kind of considering this our pilot year. So we're trying to figure out what works, what areas we can improve on, and then use that feedback to make adjustments for the next CHIP and CHA cycles. Because again, this is ongoing, this is cyclical. Oh, go back. One thing that will remain constant though is that this process is deeply collaborative intentionally. So I know that what we presented today may have been quite a bit of information, but it's all really important, it's all really relevant. And we can't do any of this work without the collaboration and support of our partners, of our staff, of the coalition, of this steering committee, and most importantly, our community members. So we do hope to have this plan complete by July of next year. Again, fingers crossed. But I do just want to thank you all in advance for your support and just your continued collaboration, because I truly do believe that we can and we will create a lasting impact in our community. Next slide. Awesome. So I think at this time, I'd like to open the floor for any questions or just overall feedback that you have. And you can use the chat, you can unmute. Any feedback, positive, negative, or in between? Any questions? All right. Next slide. All right, where do we go from here? We can go to the next one, please. All right, so as steering committee members, again, I mentioned like we are going to really lean heavily on your continued engagement. So after today's meeting, I will be sure to follow up with everyone with the recording of this meeting, with the presentation slides, and any next steps that are needed. And as we move forward in this development process, I'll also make sure to communicate all of these steps via email. So because we don't need to have consistent set meetings at this time, we will just meet kind of ad hoc, but I will make sure to reach out to everyone well in advance to determine your availability so we can maximize everyone's participation. But in the meantime, if you have any questions, if on your drive home you're thinking about the meeting today, because that's what we all do is think about work on the drive home. If you have any thoughts that come to mind or any ideas, feel free to send me an email. I'm happy to get back to you to set up follow-up meetings with anyone who might be interested in any kind of follow-up conversation as well. Next slide. All right. So as we close, if you can go back one, I'd love for each of you to just share one word that captures how you feel about this CHIP process so far. And you can type it in the chat or you can unmute to share. But what is just one word that describes how you're feeling about this CHIP process? I see great, optimistic, love it. Two optimistics, excited, enthusiastic, wonderful, collaborative, awesome, potential, excited. Trying to like respond to everybody's excited, ready. I love that, Heather. Excited. Thank you, Lake. Partnership. Thank you, Tarnisha. Jessica, strategic. Great. I love it. Great. Well, thank you, everyone. And I guess we can end this. Again, just thank you all for your insight and your time and your partnership today. It really means so much to me, especially as just a new employee coming on board. I am not able to do this work without my team and without everyone on this call, without my coalition, without our co-chairs. It really means so much to me to have you all on board and to have your contributions today, because it really does make a difference, not just for me, but I know it's going to make a difference in this community as well. So I look forward to continuing this work with you all as we lay this groundwork down for a healthier, more equitable Prince George's County. And thank you so much. And I'm giving you quite a bit of time back. But again, if you have any questions or follow-up, you can shoot me an email. Thanks, everyone.
Thank you.
Thank you, everyone.
Thanks,
Thank you.
Sherry.
Thanks so
Thank
much.
you.
Thank you. Yay.